I'm Krista. I'm the nurse practitioner with Kenosha County, and I work closely with the KORI team. I'm also a certified addiction registered nurse. We provide medication management for people who have suffered a recent overdose event. We get referrals from the Kenosha Overdose Response Initiative that are out in the field. If the KORI team determines that someone would be interested in talking to us about medication treatment options, one of our nurses will reach out and get that person scheduled, and telehealth is an option. We use telehealth often, and that first intake will be very brief, enough to talk about medication treatment options and make sure that they meet the criteria for an opioid use disorder and that the medication can be safely prescribed. The medication that is most likely to be prescribed in the setting after an overdose would be buprenorphine, aka Suboxone. That medication helps to manage cravings and withdrawal. It reduces the chance of a subsequent overdose. What we're doing through the Public Health Department with the Overdose Response Initiative is really addressing the overdose crisis and trying to prevent overdose fatalities. So the goal is to stabilize people on medications and reduce barriers for that. My background before I worked for the health department was as an emergency room nurse, so it's really ingrained in my brain to stop the life threat, and that's really what we can do with medications such as buprenorphine. And so we want to make sure that people have the option to start that as quickly as possible to be able to stabilize their withdrawal symptoms, cravings, and then again, prevent another overdose incident from happening. And our goal is to stabilize them and transition them ultimately to a long-term care provider for their treatment, but it just depends on what their individual preferences are. So we don't mandate that they engage in any other type of treatment. We know that medications work best when combined with community programs such as intensive outpatient treatments, outpatient programs, counseling, AODA services, but we don't mandate that. We still want to get people started and stabilized on medications right away. The goal is that we want to keep people alive to give them the opportunity to, recover and achieve their full potential in life.